You know, when we think about a perfect smile, we almost always focus on the teeth, right? But what about the frame for that smile? Today, we're doing a deep dive into the science of gingival depigmentation. That's a procedure that can completely change a smile just by changing the color of the gums.
Just take a look at this. On the left, you see gums that are dark and pigmented. And on the right, the result after treatment. I mean, the difference is absolutely staggering, isn't it? It just creates this whole new level of harmony in the smile. So how on earth is this possible? Let's get into it.
Seeing a transformation like that really brings up two huge questions. First, what are the actual procedures that make this happen? And second, maybe the most important question of all, is it permanent? We are going to tackle both of those in this explainer.
So to kick things off, we really need to understand why gum color is such a big deal for what we consider a beautiful smile. It really is all about the frame for the artwork.
From a clinical standpoint, the gums, or the gingiva, are a core part of facial aesthetics. And as the research points out, for some people, especially those who show a lot of gum when they smile, this dark pigmentation isn't just a minor cosmetic detail. It can really be a source of self-consciousness, and it can even have a real psychological impact.
All right, let's get into the biology of it. Why do some people have darker gums in the first place? Well, the answer lies in a process called hyperpigmentation.
So what is gingival hyperpigmentation? Put simply, it's just when the gums have a darker color than what's considered typical. It's the official medical term for what we're seeing in all those before pictures.
So what's causing this? Well, the main player here is melanin. Yep, the exact same pigment that gives our skin and hair its color. It's made by cells called melanoblasts. Other natural pigments like keratin and hemoglobin play a role too. But it's not all internal. External factors like tobacco smoking can be a huge contributor, and of course, things like ethnicity and even age naturally affect the color of our gums.
Okay, so we understand the problem. Now let's talk about the solutions. This is where we get into the different techniques used to get that dramatic after photo we saw.
The procedure itself is called gingival depigmentation, and yes, it's a type of periodontal plastic surgery, which sounds pretty intense, but really, it's just a fancy way of saying it's a specialized surgical treatment that focuses squarely on the gums to remove or reduce all that extra pigmentation.
One of the most common, most traditional methods is the scalpel technique. And you guessed it, it's a direct surgical approach that's pretty much exactly what it sounds like.
And here you can see that process in action. Just a quick heads up, this is a clinical image. So what's happening is the surgeon is using a scalpel to very carefully remove the thin outer layer of the gums, the epithelium. That's where those pigment-producing cells are hanging out. As you can imagine, it requires a huge amount of precision. Okay, next up we have a slightly different mechanical approach. This one's called burr abrasion. So instead of cutting, this method actually uses friction. This technique uses a high-speed rotating tool called a diamond burr. Think of it like a very precise polisher. It's used to gently abrade, or kind of sand away, that pigmented surface layer, and what that does is reveal the healthy pink tissue that was right underneath. Now, no matter which method is used to remove that top layer, the body's healing process kicks in pretty much right away. It's amazing, really. Within about a week, you start to see new, healthy, non-pigmented tissue forming over the treated area, which is what's just starting to happen right here. But hey, the scalpel and the burr, they're not the only tools in the box, not by a long shot. There's a whole spectrum of solutions. You've got cryosurgery, which freezes the tissue, electrosurgery, which uses an electric current, and lasers, which can vaporize that top layer with incredible accuracy. There are even chemical methods and grafting techniques.
And now for the question we ask right at the beginning, the one everybody wants the answer to. You go through the procedure, you get this amazing result, but does it last? This brings us to the catch, repigmentation.
So let's just ask it directly. Is gingival depigmentation a permanent one-and-done solution? Well, the data suggests it's not always that simple. This is where it gets really fascinating. This data comes from a systematic review, and just look at the difference in how often the pigment comes back. With burr abrasion, it returns almost 9% of the time. The scalpel technique is much better, down at about 4%. But then you get to cryosurgery, with a recurrence rate of only 0.32%. I mean, that is a massive difference when you're talking about long-term success.
And get this, the timeline for when the color might come back is completely all over the map. The source material notes that repigmentation can start happening in as little as 24 days. or it might not show up again for 8 years. It seems those pigment-producing cells can be pretty stubborn, and sometimes they just migrate back into the treated area over time.
So, with all that information, let's pull it together for the final takeaway. How does anyone actually choose the right path forward?
This table really sums it all up beautifully. You can see the different techniques, how they work, and most critically, those recurrence rates. It's pretty clear that while several of these methods can give a great result at first, how long that result lasts can vary a lot. It really seems that newer techniques like cryosurgery and lasers offer a much lower chance of that pigmentation ever coming back.
Ultimately, gingival depigmentation is a really powerful tool. It addresses an aesthetic concern that can have a huge impact on people's lives. But it also highlights this fascinating tension between our cosmetic goals and our body's own natural tendencies. It kind of leaves us with a bigger question to think about. In our quest for that quote-unquote perfect smile, how do we find the right balance between our aesthetic desires and the simple realities of our own biology?